So tonight we welcome back the international renowned researcher, Dr. Linda Carlson. And if you read the latest Digital Examiner, you would have seen that Dr. Carlson received the Dr. Rogers Prize for Advancing Health, Medicine, and Healing. This was founded in 2007 by the Lott and John Heck Memorial Foundation, and the Dr. Rogers Prize celebrates the achievements of those extraordinary individuals working in novel, innovative, and disruptive medical practices and research to advance healthcare in Canada. Dr. Carlson's received many distinguished awards, and her research in psychosocial oncology, integrative oncology, mindfulness-based cancer recovery has been published in many high-impact journals. She has published 2 full books on mindfulness topics, and she's been involved in over 250 research papers. So it's my privilege and honor to welcome Dr. Carlson.
My plan today is to tell you a little bit of background and give you a little bit of knowledge around this area, but we're also going to do some practices of implementing some of the mindfulness and the breathing in the moment that you can take home with you tonight. So you'll have a few tools and tips. So you're seeing the slides. So I'm talking about mindfulness for managing cancer-related stress. I'm going to do a little bit of an intro, though, to just situate why mindfulness might be helpful for people going through cancer or indeed any chronic kind of illness experience, and introduce some ideas that you may have heard of before, maybe not, around post-traumatic growth and spirituality. So these are ways that a cancer diagnosis can actually be a catalyst to living your best life. And integrative oncology, we heard, some of that terminology in the introduction. What exactly is integrative oncology? And then how does mindfulness and other mind-body therapies fit within that framework? And then I'll focus on describing to you our program of mindfulness-based cancer recovery that we developed at the Tom Baker and we now offer at the Arthur Child still. All right, so let's get started. So the illness experience, you all know much better than I what it feels like to hear those words that you have a cancer diagnosis, how frightening that is. So we've got our friend the spider. He says, "My life's a mess, doc. You got to help me. I just seem to be spinning out of control." Right? So that feeling of just don't know where you're going, your mind's a mess, that sense of control or loss of control is a central experience when you're diagnosed with cancer. So that feeling like you don't know what's going to happen in the future, you don't know what the course of the illness is going to be. The doctors often can't give you clear answers. And you have to deal with also that life threat. Whenever you hear the word cancer, whether your prognosis is wonderful or not, it always brings up those fears and worries about, well, what does this mean in terms of, am I going to die soon? Am I going to experience lots of pain and suffering? Like, what's going to happen to me? So there's lots of fear and anxiety, dealing with loss of certainty, and often you may have to take time off work or push back some of your retirement plans or change your travel plans, and your regular routine is out the window because you're constantly running to appointments. And so it disrupts your entire life. And there's all kinds of different feelings people have, grief and loss and sadness, but also fear and worry for the future, and maybe anger or blame or sadness about wondering, could you have done things different? How did you get here in the first place? So there's all this swirling emotions that are often difficult, and sometimes we sort of push those down while we're in treatment and they come up afterwards. And then all the symptoms and side effects that people are often dealing with throughout. So pain, fatigue, difficulty sleeping, that brain fog or chemo brain, that difficulty thinking straight. So there's a lot going on, obviously. And then after treatment, no matter how good the prognosis, for many people, there's still this fear that it might come back or it might progress, kind of lurking in the back of your mind. And that scan anxiety, they call it, like every time you have a checkup or a follow-up scan, that anxiety can kind of peak. So there's a lot going on. for people experiencing cancer. And it's not just the people themselves, it's their partners and the caregivers who are going through this. It's a shared experience. And often, the caregivers feel even more helpless and even more out of control because there's often not a lot they feel like they can do. So in reality, sometimes even the caregivers or the spouses or the partners, the children experience even more stress and anxiety than the patients themselves. So it's a family experience. Okay, that all sounds terrible, right? In really painting a difficult picture, and all those things are true. And it also is a bit of a roller coaster. It fluctuates. So how can anything be good about this? Really, is that even ridiculous to consider that? Well, I've worked with thousands of people over the years in psychosocial oncology, and some people have said that, you know what, it's really been an opportunity for me to slow down, to just pause. I haven't taken time off work. I'm not doing anything else right now, and just reevaluate. Okay, if my time is limited here, which it always has been, we just sort of live our lives as if we don't know that. To reevaluate, like what's important to me, what's brings me meaning and purpose. How do I really want to live my life? So pause, reevaluate, and many people talk about finding the silver lining. And we call this various things, but one is post-traumatic growth. So something traumatic or difficult, like a cancer diagnosis, can be this catalyst to almost bounce back and thrive and live a better life afterwards. Finding the benefits, for example, your people around you coming to support you in closer relationships, maybe, or finding a sense of spirituality or connection with something larger than yourself, the community or your spirituality, your faith. And then the downside to that, though, is what we call the prison of positivity, right? So there's this pressure, this cultural sort of idea that, oh, you just have to think positive. You have to think positive and everything's going to be okay. So it's important to see both sides of the coin, right? So I'll talk about the prison of positivity a bit more and how that can kind of backfire. And really, what's important is to be your authentic self and to recognize all the difficult parts, but also perhaps transform those to see the opportunities as well. So, this is a bit of a deeper dive into post traumatic growth and the different areas. So, we talk about personal strength. So, there can be increased resilience, self reliance, confidence, even humility. Um, and you can feel more authentic to your own ideals with personal strength. New possibilities is another part of this where people may discover new interests or new perspectives and recognize how adaptable they can be or being open to new ways. So I'm going to talk about meditation and mindfulness today. And, that may seem a little woo-woo or new agey to some folks. But again, going through this kind of experience, often people are more open-minded to try things and explore new possibilities that might actually be really helpful in their lives. We often see improved relationships, so an increased sense of belonging, more emotional vulnerability, so opening up about your feelings, whereas in the past you might have just sort of not talked about that or stuffed it down, feeling more empathetic and loving towards other people, and it can strengthen relationships when this is shared and talked about. And then there's this idea of spiritual growth, so you can develop more deeper and meaningful beliefs and philosophies of life, a deeper level of awareness, faith, clearer purpose, and appreciation for life. So we're really going to talk about that in terms of mindfulness, is just noticing everything that's happening around you, the beauty of the leaves turning colors and, feeling the breeze and really just appreciating the small things and also developing a sense of altruism and gratitude. So that's this positive psychological change that can be the result of a struggle. And when we talk about spirituality, that's distinct from religion or religiosity. So spirituality, we see on the left-hand side, it's around a broad concept of believing in something beyond yourself or bigger than yourself. So answering questions about the meaning of life, how people are connected, truths about the universe, what are my values, how should I live? Whereas what we would call religious practice or religiosity is more around the rites, the rituals, attending church, belonging to a certain community. And so there's, a distinction between those, but they can also overlap. And so people maybe feel spiritual but not religious, or religious but not overly spiritual, or some combination of both. And there's no right or wrong way around that. So let's come back to that. Oh, but you just have to think positive, right? Because I don't want to confuse you when talking about post-traumatic growth and spirituality that you just put on a happy face and everything's great, right? It's not like that. In fact, it's sometimes called, oh, that's funny. Oh, okay. The prison of positivity. So this can deny our authentic emotional experience. So I've got the breast cancer flag here. I meant to replace it, but people get that message all the time, like cancer and the power of positive thinking, right? You just have to think positive and everything's going to be great. But we sometimes call that, there it is, the happy jail, right? Or the prison of positivity, where, you might want to talk about how you're having a rough day, or you're feeling down, or you're a little worried, and people are like, no, 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 don't talk like that, everything's fine, everything's fine, you just got to think positive, right? So it denies that authentic emotional experience. So we need to find a balance between feeling confident and open and able to talk about the tough times, and if we're support people, able to hear that without trying to fix the problem necessarily. Sometimes you just want to talk. You don't need someone to try and make it better. You just want to express what you're feeling. And that's really cathartic. It's really helpful for people to just talk about what's on their mind in an authentic kind of way. Okay, so that's kind of just the introduction bit around the psychosocial oncology and some of the emotions you might experience. I'm going to talk now a little bit about integrative oncology as a subspecialty of cancer care. So we have an official definition. It's patient-centered, evidence-informed field of cancer care. And within integrative oncology, we use mind and body practices, natural health products, and lifestyle modifications alongside conventional cancer treatments. So it's not instead of conventional care, it's integrated alongside the kind of treatments you're probably already having, your chemo and your radiation and surgery and all that. So the objectives here are to optimize health, improve quality of life, improve a range of outcomes across the whole continuum. So from the time of treatment and diagnosis right through, and empower people, like giving them tools to prevent cancer and become active participants before, during, and beyond cancer treatment. So that's how we think of this field of integrative oncology. We can break it down into three main areas. So we have the lifestyle modifications, and these are the foundations of wellness. So I'm sure you've all heard about exercise and physical activity and the importance of that. Probably heard about or participated in the Alberta Cancer Exercise Program. So important for overall health. You've probably maybe even heard about the challenge trial. I'm sure someone will be telling you about it if you haven't, but this is a huge clinical trial. This was actually in colorectal cancer, but there's research also in prostate cancer where people exercise for a period of 2 years, supervised exercise, and they followed them up for 10, 15 years, and it did improve survival in colorectal cancer. Diet, so having a healthy, mostly plant-based, whole foods diet, getting proper sleep. I could talk about that a lot too, and managing your stress. So we'll be talking about that. The mind-body therapies are a range of different programs and approaches that integrate thoughts and feelings with what's happening in your physical body. So your stress response, your level of excitement or relaxation. And we're going to talk about that in the context of mindfulness meditation, but other popular mind-body therapies are yoga, acupuncture, Tai Chi, Qigong from traditional Chinese medicine, and there's many others as well. Hypnosis, for example. And then the third category is the natural health products. So that's vitamins, minerals, herbs, plants, botanicals, all those kinds of products. So those are all within integrative oncology. And if you don't have this book in your library, Brad, I heard you mentioning your library. I highly recommend it. It's called Anti-Cancer Living, written by one of my friends and colleagues, Lorenzo Cohen, and his wife, Allison Jeffries. And they go over 6 key factors for optimal health and also within cancer, both for prevention and for integrating with treatment once you're diagnosed. So I mentioned them: diet, physical activity, stress management, sleep. They talk a lot about relationships, love, and support. And the sixth one I haven't mentioned is environmental toxins. So a lot of talk about how to make your home environment safer and free from toxins. So this is a wonderful book. Really, the area I'm going to focus in on now is more around the stress management. All right, so now let's hone in on mindfulness. So mindfulness for people with cancer, survivors, family members, supporters. You may have heard this term. It's pretty popular, in the general press. Everyone needs to be mindful, So what does it really mean? I'll give you a definition here. But first, let's consider some myths. So you see magazine covers like this, and you may think that if you practice mindfulness, you're going to turn into this blissful, beautiful, calm, happy young white woman, right? So that's one of the myths that we need to bust a little bit here. Um, so mindfulness is not about clearing your mind and being, calm and happy all the time. It's just paying attention on purpose in the present moment with an open and accepting attitude. So it's just being awake and aware to your life as it's happening with a certain attitude. It's two things. It's a way of being in the world. So you can be more or less mindful no matter what you're doing. You can wash the dishes mindfully, or you can let your mind wander while you're washing the dishes, right? And that goes for everything that you're doing in your life. It's also a practice where we train ourselves through mindfulness meditation in that capacity to be more present, to pay attention, because our minds have actually, unfortunately, been trained to wander. And so we have to retrain them. So here's just some illustrations. So this is your typical mind. It's full of thoughts of the past, the future, worries, concerns. This is probably our most mindful friend, the dog. He's really in the moment. And this illustrates the practice of sitting down and meditating. So what's your mind doing if it's not paying attention in the present moment? And what happens when our mind wanders? What happens to our mood? So it turns out we have anywhere from 50 to 70,000 individual thoughts every single day. Lots and lots and lots of thoughts. Oh, I was going to do a quiz, but I'll just give you the answer. So if I were to ask you, how much of the time would you think that you're actually paying attention to what's going on with all those thoughts? Often people say not very much, right? Well, when they've done studies and they, sort of ping people throughout the day and they say, what are you thinking about? What are you doing? They're able to show that about half the time we're not thinking about what we're doing. So our mind is wandering. And the really interesting thing about this too is that people reported feeling happier when they were paying attention to what they were doing, no matter what they were doing. Right? So you're happier if you're paying attention while you're washing dishes than if your mind is wandering while you're washing dishes. Why would that be? Well, I think the answer is in where the mind is wandering to. And there's two main places it tends to go, none of which are particularly pleasant. So first, you could be like this guy who is reliving the past. He's thinking, oh, why did I do that? Or why did I say that? Or if only this, or if only that, things would be different. Or he's saying, why me? Why did this happen to me? Or geez, I shoulda, coulda, woulda done this or done that or said this or said that. And so he's ruminating on the past and he's feeling really sad and maybe he's angry, maybe he has regrets, right? So he's on and on thinking about stuff he can never change. You can't change the past. You can learn from the past, but you can't change it. So ruminating on it just makes you feel rotten. Or you could be like this woman who's rushing off to the future, right? She's got all these worries, stress, her money, her health, her debts, the pressure, the deadlines. What if this? What if that? Imagining all the terrible things that might happen. Well, that's not great either, right? It doesn't feel good. You get anxious, you get stressed, you're worried. So you're in the past, you're feeling miserable and sad, or you're in the future and you're feeling worried and anxious. That's why when we pay attention in the present, it's generally better than all of that, because in the present, often things are kind of okay. So that's the whole point of mindfulness, is learning and training ourselves to be more in the here and the now rather than the past, the future, and planning and all that kind of stuff. So we can break the mindfulness down into these three components, and really they're the why practice mindfulness? What's our intention? The what do we actually do? We train our attention. And how do we do it, which is really important too, that's the attitudes. So our intention is on purpose. You know, your purpose could be quite broad ranging. Maybe you just want to be awake and aware for your life. You know, maybe you want to try and enhance your spirituality or your connection. Maybe you want to prepare for death and dying even. Maybe you just want to sleep better, right? So the intention can vary. The practice is training ourselves in paying attention. So we do that training through mindfulness meditation. And how we do it, these attitudes that are open, accepting, and kind, and non-judgmental. It's really important because it can be challenging at first when we begin to notice how crazy our minds are. You know, we can be like, oh, well, this is too hard. I can't do it. But really, we just need to be patient and kind. So these are some of the core mindfulness attitudes: non-judging, patience, allowing time for the mind to adjust, accepting how we feel and where we're at. You know, accepting isn't like giving up or giving in or even liking it. It's just seeing clearly where you're at as a starting point, and then you can move forward. Letting go of control, right? I talked about sort of realizing that we have less control. It's recognizing that and going with the flow, non-striving to change things we really can't change, and focusing on the things we do have some agency over. Trusting the process, trusting our judgment, and seeing the world as if for the very first time, which is called beginner's mind. And so, you know, people sometimes say, well, gee, that's a big ask, changing all these attitudes. And we say, well, you know, you could be the opposite. And what would that be like? You could be a judgmental, impatient, rejecting, grasping, striving, suspicious know-it-all, right? Maybe you know someone like that. Or maybe you are like that sometimes. Well, it's a recipe for stress. It's not a lot of fun to be that sort of person. So this is moving you away from that. So I mentioned some of the myths of mindfulness. So it's not just relaxation. And in fact, you don't always feel relaxed when you're paying attention to, say, pain in your body or something like that. So it's not just relaxation, although you may feel relaxed. It's not the objective necessarily. It's not like hypnosis where, you know, we're trying to get an altered state for a certain outcome. It's not a religious practice, although it can be incorporated into any religious practice you may already have. It's very secular. And it's not clearing your mind of all thoughts. Your mind rarely goes blank. It's just honing your focus onto things that are happening in the present moment. And as I said, it's not always peaceful and calm, although sometimes it may be. So here's a nice poem that illustrates some components of mindfulness. You may well know it. I went to the woods because I wished to live deliberately, to front only the essential facts of life, and see if I could not learn what it had to teach, and not, when I came to die, discover that I had not lived. So that's Thoreau. We went to the woods in Walden. And really, it's just about being awake and aware and to the beauty of life, because all our moments are limited. So here's another book that you should definitely have in your library. It's called Full Catastrophe Living. It was written by a fellow named John Kabat-Zinn, who developed systematic training in mindfulness in a secular way in medical context called mindfulness-based stress reduction. So it's been around for like, well, since the 1970s. So I guess we're getting into 50 years now since he developed it. It's a standardized 8-week group program, combines stress reduction with meditation, helps people bring regular daily practice into their lives. And there's hundreds, actually thousands now of research studies showing it's been very helpful for a wide range of people and symptoms and populations. That's a website that has all the data. If you're a science nerd, you can go there and see all the papers. This is an interesting graph, actually, that's produced by the American Mindfulness Research Association. And it shows the number of mindfulness research studies in scientific journals over the years. So let's take a look. So you can see it starts way back here in 1980. There was literally like 1 or 2 every year. And this is just from a scientific website, Web of Science. And you can see it sort of takes off at one point. There's like well over 1,000 publications. You know, this is across all areas of mindfulness research. So pretty much every psychological condition you can imagine, every physical condition. There's just such a growing body of research of its many, many benefits. All right, so that's lots of talking. Let's take a moment to take a mindful pause. So we're just going to pay attention to what's happening in the present moment. We're going to do it in the body with our breath. So why don't you take a moment to notice your posture If you're kind of slumping over, let's make some space for the breath. So sitting up a little bit more upright. If your feet reach the floor, have them just resting on the floor. You might inch forward a bit on your chair so you can sit upright. Now take one hand and place it over your chest, just right here. Take your other hand, place it over your kind of lower abdomen, your belly. Notice any judgy thoughts there about the belly. Let them go. Okay. So now we're just going to pay attention. So you don't need to change anything about the breath. We're just going to play like breath detective. So you can close your eyes if you want. And just note to yourself in as you breathe in. Feel the movement in the chest, in the torso, and note out as you breathe out. So don't try and change the breath, just notice it. So notice as you breathe in, how long the breath is, if it's smooth or jerky. Notice if there's a pause as you transition to the out breath and as you breathe out. Notice the length there and any movement in the body. So notice if you feel more movement in the upper hand or the lower one. And notice also any tension you may discover, say, in the shoulders or the jaw or the face, the legs. Often we hold tension in the body without really noticing. And when your mind wanders, which it may well do, probably already has, just as soon as you notice, kindly bring it back to just noting in and out, feeling the rising and the falling of the breath. And as a breath detective, just seeing what else you can notice. Maybe the heartbeat, your stomach, digesting your dinner, thoughts coming up and just letting them go. Just imagine riding the wave of the breath in and out. Just a few more breaths. And notice if there's any change in the breath as you continue to pay attention. Again, without trying to change it, just noticing. And with an exhale, just lowering your arms, opening your eyes if they were closed. And normally if I was with you there in person, I'd just ask what you noticed there. I don't know if people want to just shout out a few things, or you can put a note in the chat. How did it feel? What did you notice about the breath? Or where was the movement? And did it change at all? I'll just give you, I'm not sure if you're chatting amongst yourselves or just reflecting. I'll give you one more second to think about that.
I noticed when I was breathing, when I reached my in-breath to the top, I straight away went right down and breathed down again. But when I reached the bottom after I breathed out, I sat there for a second or a second and a half before I breathed in again.
Oh, that's very interesting. Yeah, and usually the pause after the exhalation is a restful pause, a relaxing pause. Did it feel that way to you?
Yes.
Yeah. Yeah, that's fascinating. Did anyone notice any changes in the breath as you paid attention?
Mine increased.
Increased how?
Uh, it was longer, it got longer and longer each time.
Right. So it actually slowed down a little bit, the pace of the breath.
Yes,
Yeah. And how did that feel when that happened?
more relaxing.
Yeah, it usually does. And so that's interesting because that's a common experience. And, I say don't try and change the breath, but what tends to happen when we actually pay attention to the breath is that it finds its own natural, healthy, more balanced rhythm that often makes us feel more relaxed if we've been a little keyed up. So that's a very simple mindfulness exercise you can do is just follow the breath for a little while, and often it'll settle you down a little bit. And I'm going to show you some more specific ones too, if we have time as we go through. So I'm going to carry on here. So the program that we created based on that MBSR I just told you about is called Mindfulness-Based Cancer Recovery. And as I said, we started developing that way back in 1996 here at the Cancer Center with some of my colleagues. And they were saying to themselves, what do we do when we're stressed out and times are rough? We actually go to our own practice of yoga and meditation because they were all practitioners of those types of mind-body practices. And so they were starting to put a program together, and I showed up as an eager student just finishing my PhD in 1997, and I knew about John Kabat-Zinn and MBSR, and I said, hey, there's already this thing. We should do that. And so we looked at the experience of people with cancer, all those things I talked about, and we kind of adapted the MBSR so we could address some of those issues. And we started offering classes in 1998, and we have been offering them nonstop ever since then to people with cancer and family members. So we do them in groups of about 15 to 20 people. We have at least 3 groups every year and sometimes up to 9. And, sort of we do a fall session, a winter session, and a spring session. Typically, we just actually started the fall one this morning. And so by doing that for so many years, we've had thousands of people through the program. And that's how we have done our clinical research studies, is that we embed them into the clinical service. And so we've done many, many research studies, having people fill out surveys before and after, and, we poke and prod them and do blood and saliva and all kinds of things. I'll tell you a bit about that in a minute. So the way the program is set up is that now it's a 9-week intervention. We do 2-hour weekly meetings. There's a couple of instructors, and it follows a similar format every week. There's a discussion, sometimes around home practice or some sort of learning of strategies. And then we always do mindful movement based on yoga practices and then different forms of meditation. So each week we kind of add on to that. There's a booklet that outlines the program, and people are encouraged to do daily meditation practices so it becomes a habit and trains them in that capacity to be more mindful. They keep track of their home practice, and there's a longer retreat near the end of the program. So the overarching theme is mindfulness. It's all different ways to learn mindfulness and integrate it into your life. We teach relaxation through different types of abdominal breathing. There's this gentle yoga or mindful movement that helps to embody or bring the practice right into the body. So we become more in touch with when we have tension or when we have relaxation. We teach people about the mind-body connection, how that works, use things like visualization and imagery, talk a bit about cognitive coping, so the stories we tell ourselves and how sometimes those stories are more or less helpful or more or less correct. And so learning how to evaluate the stories we tell ourselves. And also it has this element of personal empowerment because we're giving somebody back something they can do to gain control over how they're feeling. And social support because it's done in a group, which is really helpful too. So there's different themes, introduction to mindfulness, talking about the attitudes, the wisdom of the mind and body, balance through some breathing exercises I'm going to show you. Mindful coping, as I mentioned, using imagery, really deepening and expanding our practice as we get more experienced, and then talking about how to make this part of your daily life. We do a whole bunch of different meditation practices. So a body scan is just sort of lying down and slowly bringing your awareness through your body. Sitting meditation, walking. Here, I'm going to show you the pictures that go with it. There's people doing a body scan, so they're not napping. They're actually bringing their awareness through their body slowly, checking in, paying attention. Sitting meditation, we don't sit like pretzels on the floor. Most people will just sit in a chair like that. walking mindfully, slowly, paying attention to our body and our surroundings. We use images like lakes and mountains to embody kind of qualities of the lake and the mountain. And we also do loving kindness practice, so to bring feelings of kindness and compassion to ourselves and others. So we include the gentle yoga. A lot of the practice is the movement. And again, this is just to sort of refamiliarize ourselves with our own bodies and get the body moving again. So it's less of an exercise or, kind of trying to perform it. It's more just mindful movement. So another book for your library. This is a book Michael Specka and I wrote about the program called Mindfulness-Based Cancer Recovery. It's been out since 2011. It's in a bunch of different languages, but it covers the curriculum and it's meant to be like a home study, focused to be patient-centered so that anybody could follow along and do this themselves. So I won't spend a lot of time talking about the research, but I'll sort of summarize a little bit of it here. So we started looking at those common symptoms that are so troubling to people. And indeed, in the different research studies we've done, there's decreases in stress symptoms, there's improvements in mood, less anger, less anxiety, less depression. People sleep better, they have less fatigue, they ruminate less about the past, they worry less about the future. And we've studied the partners who've come along with the people who have cancer, and they also improve to a similar degree as well. And then we don't just stop there, right? So like I talked about at the beginning, so there's symptom reduction, but then there's actually enhancing our well-being through improving overall quality of life and elements of this spirituality, this feeling connected, seeing the potential for personal growth after practicing mindfulness. And we see improvements in overall mindfulness as well. And as I said, we like to poke and prod people. So we have looked at things like blood pressure, which improves. We've looked at the stress hormone cortisol through saliva samples, and that improves as well. We look at inflammation through the cytokines in the immune system, and so we've seen changes there. And even down to the level of the DNA with telomere length and gene expression. We've also shown improvements there. So we do truly know that these practices happen in the mind and the body simultaneously. All right, this is just a reminder to pause. Oh, we're going to just talk about some of the remote stuff and then we'll do some practice. So we did this program for many years in person, right? But not everybody can come to Calgary. There's people all over Alberta and all over the place who can't come because of geography or, even some local people, just the time to take off work and come and park is a barrier, and the cost of all of that. And sometimes the symptoms themselves, you're just too tired to do the big outing like this, or you're in too much pain or worried. And if people have immunosuppression, they may not want to be around groups of people. And during COVID-19, obviously, we had to really adapt. So we switched to an online Zoom-based version. But we've also developed other digital health interventions. So the online program, you can get it through Wellspring that I imagine you're aware of. So they do online MBCR. And at the Arthur Child, we alternate between in-person and virtual. So our January, we decided to do our winter session virtually. So anyone can sign up for that. And we've also developed an app. So we've translated the mindfulness-based cancer recovery into an app called the Mindfulness-Based Cancer Survivorship Journey. It's a bit of a mouthful, on a bigger app. And that's where you can get it. And we're also doing a research study right now on it. And I'm going to show you how to sign up for that if you're interested. We also developed a virtual reality guided mindfulness meditation program that we've just pilot tested for people who had pain. And that's the app, and that's sort of the virtual reality. So that's a really interesting way to kind of jumpstart a mindfulness practices by using virtual reality. So this is the mindfulness app study. It's called Seamless. We're right now in the middle of a Canada-wide trial where we're recruiting 345 cancer survivors. So people are meant to be done their primary treatments, but if you're on maintenance therapy like hormone, ADT or something like that, you can still participate. And it's any type of cancer all across Canada. So that's a website there, the seamlessstudy.ca. It's got the information there and how you can contact us to see if you might be eligible. If you haven't done a mindfulness program before and you want to try the app, you can do it through the study. If you want to take a virtual program, you can either take it through Arthur Child in the winter, or you could do it through Wellspring. I think this fall they might still be having spaces. Okay, so now we're going to do a little bit more practice just to finish off here. And I'm just going to teach you a little something about your nervous system that you may or may not have already known. So we can divide our nervous system into voluntary. So that's when you want to raise your arm, you think I want to raise my arm, and up your arm goes, right? You're doing that on purpose. It's voluntary, you know, you're going to run or whatever you're going to do. There's all that stuff that happens, but most of what your nervous system does is automatic. And that's called the autonomic nervous system that takes care of that. And so you think about it, right? You don't have to tell your heart, okay, beat, beat, beat. You don't have to tell your stomach to digest your food or your pancreas to secrete whatever it's secreting or your liver to do its job or your lungs to breathe even, right? All that stuff and your hormones and everything is happening automatically. So that's controlled by the autonomic nervous system. Now, within the autonomic nervous system, the big A, we talk about two arms or branches. So like, I'll stick my arms up. And these are called sympathetic and parasympathetic. So sympathetic, when it's activated, that's your fight or flight reaction, right? You're driving along, dog runs in front of the car. All of a sudden, your heart's racing, your hands are sweating, you know, your muscles tense up, you feel that zing. That's your sympathetic nervous system being activated. And it can be activated by all kinds of things, not just an almost near miss emergency, but, you know, getting frightening news, right? Or having an argument with your spouse or being stuck in traffic. So that activates that and you feel jittery and you're tense and your breathing is shallow. So that's your sympathetic. And then the other arm is called parasympathetic. That's your relaxation response, right? So they're kind of in counterbalancing. So when you've got the fight or flight, you're obviously not relaxed. But if you can activate your relaxation response, that decreases that fight or flight reaction and you feel much more relaxed. So we started doing that just by paying attention to our breath. Now, the really cool thing about this is that our breath is connected to the autonomic nervous system. How? Okay. So when you're feeling stressed, how do you breathe? Kind of short and shallow, right? You're kind of emphasizing the in-breath. And when it's time to relax, you kind of go, big sigh, a big exhalation. Well, it turns out that the inhalation stimulates the sympathetic nervous system. So emphasizing the inhalation makes us feel more energetic or aroused or stressed, as the case may be. And emphasizing the exhalation triggers the relaxation response. So if we lengthen the exhalation, we trigger the relaxation response and we feel calmer. So that's exactly what this diagram is showing, right? So the inhalation is associated with the sympathetic or the arousal of fight or flight, and the parasympathetic is associated with the exhalation. So that's the neat thing about breathing, is it happens automatically, but we can also voluntarily control our breath, and that's our entree into the nervous system. So there's a number of ways to apply this. The most basic way is to just allow the breath to naturally deepen and then create different balanced breaths so that the inhale and the exhale are even. So the first one I like to call the wave of the breath. I'm going to show you the diagram. So the idea here is that first we're just going to relax a little bit, like just let your shoulders down, soften through your belly, and let your breath find itself a nice rhythm where you're kind of breathing in for 4. Now, we don't want to force this, so we just allow it to kind of happen. And then as we exhale, breathe out 4, 3, 2, 1, and then inhale 1, 2, 3, 4, 4, 3, 2, 1. And so the trick here is to find a rhythm that is comfortable for you. It doesn't feel forced. And you can sort of follow that really smooth wave up and down. So we're not holding and pausing in this one. We're just trying to get a nice fairly deep, smooth rhythm. So I don't know if you're trying it, but if you're not, let's just try it. And you can close your eyes and visualize the wave or look at the picture, or you can do little figure eights if you want. Okay, if you start to feel like lightheaded or dizzy, you just gotta quit trying to control it so much. Just let it flow. All right, so if you had your eyes closed, you were practicing that, you can come back to your normal breathing now and just wonder how that felt for folks. Good, bad, it was difficult, easy.
All that steady breathing just calmed everybody right down.
Yeah, that's what it does. And here's another one that I like that adds in that pause we talked about. And we start with the square breath. So if you imagine you're breathing in for, I don't know, 4, whatever, and then with your lungs mostly full, not bursting, but mostly full, then you just pause. And you can pause for, say, two beats. That would be like a rectangle. 4 in, pause for 2, 4 out, pause for 2. Or you can hold it a little longer, you make it a square, breathe in for 4, hold for 4, out for 4, hold for 4 at the bottom. Let's just try it. So again, you can close your eyes or just soften your gaze or look at the diagram. And so you're breathing in, you're feeling your lungs mostly full, and then just have a little pause. If it gets uncomfortable, just exhale then. So your lungs are mostly empty. And then try a little pause at the bottom. So just practice that for a few breaths. And as you're trying to get the hang of this, just noticing how the pause feels with your lungs full versus how it feels with your lungs more empty. Okay, let's open our eyes or come back to the normal breathing. That one's often a bit more challenging for folks. How was that for you guys?
A bit more challenging.
And so what sometimes people notice is that when you hold your breath with your lungs full, and what's happening physiologically, because it's sort of prolonging the in-breath, is that you can feel your heart race. Your heart speeds up a little bit. It feels a little more energizing, and sometimes a bit uncomfortable. And then when you hold your breath with your lungs empty, that's kind of like emphasizing or extending the exhalation. And that tends to be, like the fellow said before, it's a bit calming. It's not always the case right away as you're trying to get the right timing and everything, but I wonder if anyone noticed that.
I noticed the opposite.
The opposite, so it was uncomfortable
When
to
I
hold.
exhale, yeah, the pause
Yeah,
is harder because
yeah,
I
that's not uncommon
force
too.
myself not to breathe in.
Well, sometimes you don't want to empty or fill your lungs completely before the pause. So you kind of exhale to maybe 75 or 80% empty and then have the pause. Or another thing you can do to extend the exhalation is to just exhale steadily, but kind of titrate it so that the exhalation is just longer. And that's a way to sort of calm yourself down. Well, let's do a couple more. So building off so the last two were balanced, right? The wave and the square were sort of balanced between in and out breath. This triangle is emphasizing the exhalation or the relaxation part of the breath, because we just breathe in for 4 and then we immediately breathe out, and then we pause just after the exhalation. So basically 2/3 of the breath is stimulating the relaxation, and whereas just 1/3 with the inhale is kind of more energizing. Again, it takes some time to quite get the rhythm, but let's give that one a try. So you can imagine the triangle. So just sort of breathing in until your lungs are pretty full and then immediately breathing out. Don't completely empty the lungs and then just pause. Okay, I like that one. I could keep doing that one for a while, but I'll stop now. So how do people find that?
Good.
Better.
Better? Yeah. And these take a bit of practice, but they're great to use like in the moment. We call these mini breathing exercises, because you could use it like, say you're going for radiation therapy and you're getting in the machine and you're a little anxious, a breath like this is really helpful, right? Or you're, I don't know, stuck in traffic or you're in a rush, any time you want to calm yourself down, a breath like this is really helpful. And nobody would know you're even doing it, right? If you have your eyes open. Now, this is the opposite. This is when you're feeling lethargic and you're kind of sleepy and you need to perk up. So this is called an invigorating triangle breath. I use this a lot of times driving on the highway because I work in Calgary a couple of days a week and I live in Canmore and I'm always falling asleep on the highway. So I do these breaths quite a bit. So the idea here is to emphasize the inhalation or the sympathetic or the, kind of energizing quality of the breath. So here we're breathing out and then immediately in, and we're just holding or pausing with our lungs mostly full. So if you want to wake yourself up a bit, let's give it a try. All right. I always find it interesting that I can feel my heart beating in that pause. How did other people find that?
How long should the pause be?
It's up to you. If you want to make it a perfect triangle, the pause is the same length as the in-breath or the out-breath, but you can experiment with holding it as long as you want. If you're enjoying the pause, just stick with it. If, you're feeling suffocating or gasping for breath, then, shorten the pause. These are really fun breaths to just kind of experiment with, and making them longer or shorter or doing it for 5 minutes or 10 minutes. It's actually it's quite fun to see how powerful they are in terms of affecting what's going on with you physiologically, but then also it affects your level of feeling like your mind too, right? If your mind is racing and crazy, you slow down the body with the breath and your thoughts also slow down a little bit and you feel a little more calm. All right, so that is it for the exercises, and I'm just going to summarize what we talked about here. So mindfulness is present moment, non-judgmental awareness with those attitudes of acceptance, kindness we talked about. And it's both a way of being in the world. So you can be more or less mindful no matter what you're doing. But the capacity to be mindful is a skill that's cultivated through this meditation practice. And programs like mindfulness-based stress reduction, mindfulness-based cancer recovery, systematically train people in mindfulness. And we know through the research they help decrease a range of symptoms like anxiety, stress, depression, and help people cope with everyday stressors. So here's some ways that you can get started. You can do some of those mini breathing exercises I showed you anytime. There's a number of free apps you can get and websites that have guided meditations that are right on there. And I'll share these slides with everybody, with you guys, so that they can get sent out to you so you can have some of these links or take a picture of it or whatever. So lots of free guided mindfulness meditations, apps out there. That's my website with all the scientific publications. You can email me. I'm not on Twitter much anymore, or X. There's a website for mindful cancer recovery that's got some resources on there. There's also a program through this eMindful. It's called Vibe, that has recordings of MBCR sessions that you can access. And then I already mentioned Wellspring, and the Singapore Center for Mindfulness also has MBCR, but you're here in Calgary, so you would probably choose Wellspring. So there's some other resources for you. And that's it. So I will unshare. Here we go. And I don't know if we have time for questions or we just want to wrap it up. Oh, I see clapping. Can't hear it, but I can see it.
I now understand some of our yoga exercises where we're learning how to pick which nostril you breathe through.
Well, that's a little more complex. We actually do that too in our program.
Yeah,
It's
so
good. That's good fun. Yeah.
yeah, that's excellent. So, and I'll be watching Wendy on the couch just to see if which breathing pattern she's using, figure out my stress level, whether it should be here or there. Yeah. So that was very good. I don't know if there's any questions on the
There's
chat.
one question. Richard asked if inhales should be through the mouth and exhales through the nose. Generally, we do inhales and exhales through the nose. Yeah, and if anything, you always want to inhale through the nose because that filters out, like it warms up the air and, filters out any stuff that might be in it that you don't want to breathe in. Exhaling, some practices have you exhaling through the mouth. Typically, we just inhale and exhale through the nose.
Okay, thank you, Linda.
Yeah,
Thank you for your presentation. Very interesting.
Can you tell us a bit more about the app, please?
Okay, so the app that we're testing isn't publicly available right now because it's part of this research study. So the only way you can access it right now is if you're part of the study, but we will be making it available after that's finished. In the meantime, there's other more generic mindfulness apps that you can download and use. They're not specific to the mindfulness-based cancer recovery program, but they have teaching and guided meditations that you can use. One that's free that I've tried out recently is called Medito. It's like Medito. And a lot of these apps is frustrating because they have this, a few things that are free, but then they try and get you to upgrade, right? They call it freemium or whatever. So they're always trying to get you to buy the next level, but there's a few free things. So the really popular commercial apps like Headspace and Calm are like that. There's another one called Insight Timer that I like, but they used to be free and now they're trying to get you to pay. So Medito is the one I've come across that it seems like it's all free.
Linda, another question I just put in the chat group
Oh,
there.
yeah.
I
Anti-cancer
didn't.
living. Yeah. It's Lorenzo Cohen, Cohen. And his
Lorenzo
co-author, Lorenzo, like Lorenzo. Cohen's,
Cohen.
yeah, Cohen.
Yes.
And his co-author is Allison Jeffries. But if you look up Lorenzo Cohen, you'd find it.
Allison Jeffries.
Jeffries, yeah.
Yep. Thanks very much.
And those
Yeah,
books
and
can be purchased online.
yeah, and they're paperbacks, they're only $20 or whatever. But I think having a copy in your library would be really great for your members.
Yeah. Because we're always looking for different material, so that's good.
Yeah, I think there was 3 books in my presentation that I recommended. So
Yeah, I took pictures of those ones. So
it's awesome.
it's faster than me trying to write down the titles because the slides were changing. So
Yeah,
perfect.
for sure.
Yeah. So we'll make sure we update our library. So with that, if there's no more questions, we're going to say thank you to Linda for her generosity in taking the time to spend with us this evening. We so appreciate it. It's such valuable information, and we look forward to having you back again in the future. So
Well, I'll try and come in person next time. It's always nice to visit with your group, really wonderful group of people.
excellent. Well, we're going to let you go.
Okay, bye-bye.
Yeah.